we are going to be exploring, defining, and then diving into the 4 core relationships that you are going to use to create a therapeutic presence that serves the folks you work with. We're going to start by anchoring into this idea. Is the job to solve their problem? Is the job even to help them solve their problem? Or is your job as a clinician to help them have a different relationship with themselves? So here's my suggestion. Even if this is a new concept for you or you're just trying this on, I wonder if you could pretend with me for a moment. If this is feeling, kind of wonky for you, just come along this journey with me for a little while so you can try it on and see if this ends up being a fit for you. So my job as a clinician is to create a space for them to have a new, different, deeper relationship with themselves. That way they can find solutions to their problems, move something from their okay list to from their not okay list to their okay list. They can do the things they are going to need to do. And maybe you'll lend them a new skill every once in a while for sure. I want you to work with your clients on things like boundaries or, hey, here's how it would sound if you said that directly. Let's work through that. Those are great things. I want you to do those things. And the main job is help them have a different relationship with themselves. In order to do that, I think it really helps us to focus on 4 core relationships. Those are your relationship to yourself, your relationship with not knowing, your relationship with of-course-ness, and your relationship with power. Those are your 4. And I'm going to jump into each one of them. But before we do, I want to tell you about a piece of outcome research that's one of my favorites out there. And this is a paper that is called Love Yourself as a Person, Doubt Yourself as a Therapist. What these folks found, they did a meta-analysis of outcome research. And what they found is that you weren't necessarily getting better outcomes because you had trained X number of hours or because you were 25 years in the chair. That was not actually the determining factor. What were essential determining factors were 2 things. One is that the therapist held some doubt about whether or not what they did was helpful. And while they were working, they were very loving towards themselves. They were kind. So let's start there. Your relationship with yourself matters. Why on earth would that be? Think back to all of that neuroscience we've been talking about self-compassion. If you want to help your brain get some of that GABA flow while you are working, if you want to add regulation to your own system, I don't know about you, but for me, this work adds plenty of activation to my system. I don't need a whole lot of help adding activation for me to support my integrated state. What I need is adding a little bit of regulation. And so my relationship with myself matters a ton. And when I have that self-compassion, I'm more likely to stay in those integrated states so I can respond more flexibly so that I don't get defensive. And as an extra bonus, when I'm actually living, not just pretending, but living in self-compassion in the room, what's happening too is that my brain is modeling, oh, here's how to do this. And so my clients are going to start subconsciously picking up on it. So I have a curiosity for you is, can you love you while you're doing your job? Can you see that you're not alone? Can you see that we are trying to do a really hard thing Can you see that you deserve kindness? And for those of you who struggle with self-compassion, I do not want you to take from this that, oh, I guess I can't be a good clinician because Jules says you have to have self-compassion. That is not what I'm saying. Where you are is completely coherent. And if you are one of those folks who struggles with self-compassion, and at this point, I don't as much, but I was one of those folks who had none at all for many, many years. I just say that to help you really deeply get, like I want you to feel it in your bones. You're not alone. There are tons of clinicians out there who struggle with having any kindness to themselves, especially while they're working, especially while they're trying to serve those folks who are in front of them, to be with their clients really well. It's normal for us to beat ourselves up. And for a lot of us, we learned you beat yourself up to make yourself better. So I don't want you to think that I can't do this right or I'm alone in this. You're not. You're not at all. And I also want you to remember that self-compassion is a skill that you can gain. So no matter where you are starting, you can grow this skill. And it is a skill that I don't think we go, oh yeah, I got that one now, check. I don't think it's like that. I'm still on a journey of deepening self-compassion, and I will be for the rest of my life. There is no finish line to this process. If you are one of those folks out there who is struggling with not having a lot of compassion, I do have a tool for you, a skill to start adding to your repertoire, is can you have compassion towards the fact that you don't have compassion right now? So I want you to have compassion towards the not compassion space. And if you need to, there are lots of folks I've worked with who this particular skill has helped with. Go ahead and imagine that you are doing therapy, but instead of sitting in the therapy chair, step out and stand in your doorway, and you can even have me come and stand with you. I will be right next to you while we do this. Stand and watch that session. So imagine a session. It doesn't even have to be a session that went hard, right? It could just be normal session. There you are doing your thing, right? And instead of focusing on the client, I want you to shift your attention in that doorway. I want us to look at the clinician and just wonder, would it be okay to send a little kindness towards that sweet human, the one who's doing this hard job, who took on this role of therapist, this role of coach, this role of healer? So wherever you are in that journey, I just want to encourage you to meet yourself where you are and to start to be kind to yourself. This is a skill that you can scaffold. So sometimes when I'm working with folks who do struggle with this, adding compassion after session is going to happen for a while before you can suddenly be able to use it in session. So don't be worried if you need to lag that timing a little bit in order to scaffold growing this skill. Now I want to transition to your next relationship. Your relationship with not knowing matters. What do I mean not knowing? I mean that the truth is we don't know what's going to happen next. We don't know if the thing we just did was particularly helpful. We don't know. There was a woman who I read a lot. I wish I knew her in person. I do not. Joan Halifax, who is a teacher, Roshi Joan Halifax, and she wrote a book called Standing at the Edge. And she talks in that book about falling and falling and falling and falling. She said, life is falling. And that's the bad news, that we're always tumbling through one moment of not knowing into another moment of not knowing. And the great news is there is no ground. You just keep falling and falling for all your life. And making peace with not knowing can be a hard, hard, hard thing. And I get that. And when I say yes to doubt, I make space for the wisdom that's going to come from my client. And I'm modeling that we don't have to know to be worthy of love, right? We want to join our people in the mysteries that we're going to unfold together. And if I know exactly where I'm going, if I know exactly what's going to happen next, then I won't be able to be open to the mystery of what could be possible. A lot of times I'll tell people, could you hang out in the hammock of not knowing? And that's kind of where I want to encourage us to be. Could we hang out in that hammock and chill with not knowing? A lot of folks will watch demo tape that I do or ask me about how it feels in the room. And folks are generally surprised that actually I'm lost. I don't know. If a session's going really well, I get lost 20, 30 times a session. That's how I know it went great. And here's what I mean when I say that is I'm in a complex system and my client's in a complex system. And here's this third complex system that exists between us. And here we are. If I think I know exactly what I'm doing or know exactly what's going to work or know exactly how you're going to answer me next, I am fooling myself. The truth is we don't know. And you take that and multiply it a ton when we start talking about couples. There's one person who has a relationship with themselves. Oh, here's another person, the complex system inside them. Oh, another. There's 3 plus the relationship with the couple. There's 4 plus my personal relationship with that member of the couple. Here's 5 plus my relationship with that member of the couple. Here's 6 and plus there's the 3 of us all together. Oh, now we have 7 complex systems in the room we're holding all together. If you are needing to know, you're in a fight with reality. So I wonder if you could move not knowing into your okay category. And I think that's why folks are surprised to hear that I'm lost. They're like, well, you don't look lost. And I'm wondering, do you mean I don't look scared? Because okayness, I have okayness with not knowing. Not knowing is in my okayness list. And so when I'm lost in the room, I go, oh, good, I'm back in reality. Now what? That doesn't mean I lose my power to do anything. It just means, of course, I don't know if what's going to happen next is going to be helpful. It's an offering, and that's all we got. So I want us to be really gentle and start moving into not knowing with grace and ease and joy, really, because not knowing is where the magic happens. Now I want to shift us and look at your relationship with of-course-ness. Of-course-ness is my word for coherence. It goes like this. Oh, of course that's happening for you. I actually have of-course-ness with every single moment. Whatever my client says, whatever my client's feeling, of course that's what they're saying. Of course that's what they're feeling. If it was important for it to be anything else, it would have been. So I'm embracing of-course-ness so that I can join with my client with full acceptance, honoring whatever their inherent internal wisdom is, their coherence is. Everything actually makes sense. If I run into a spot where, this doesn't make sense, it's not because it doesn't make sense. It's because I have not found the internal of-course-ness yet. But when I just lean into, wait a second, what if everything that is happening in front of me is exactly what's supposed to be happening in front of me? Then I stop trying to push with reality. I just stop, actually, this one in particular helps me stay out of agenda and judgment. I have way less frequent agenda and judgment in the room because of this, because of course you don't want to do this thing right now. That makes, okay, I don't even know why that makes sense, but I trust that it does. So this is about building a deep trust in their system, that there's some internal map in there that makes total sense. And for some of my clients, the feedback I've gotten is that nobody ever trusted me before. And I learned to trust me, Jules, because you trusted me. I cannot tell you what a huge gift this is for folks who maybe walked through the world not being believed, not being trusted. If you can really hang in with, of course, that's what's happening, and just meet reality as it is in front of you. Meet that being as they are showing up in front of you. The amount of worth they feel from that is enormous. Now let's shift again. The last relationship I want you to pay attention to is your relationship with power. We've been talking a lot about power over, power under versus power with, power to, power within. When you're thinking about this, it is likely that you are swimming in a sea of feelings and emotional knowings in your subconscious brain about power. I want to encourage you to be curious and brave as you look within and discover what in your clinical training and your cultural context and your family and your peers and other job spaces that you've been through in this lifetime have taught you about power. When we really face that with curiosity and compassion and bravery, we can find lots of pockets where, oh wow, in that moment I was taught to be power over, or in that moment I was taught to let go of any kind of empowerment, go power under position. I wonder if you could really deeply challenge yourself to look at what your subconscious knowings are about power so that you can be more power with in the room in a purposeful way. Now I want to invite you to go experiential with all this. Think about all of the 4 relationships we've been talking about, and get out that journal and feel into your body and be with your feelings and make a drawing or write a story or write a poem or just free flow write about it, however works for you. Think about my relationship with myself, my relationship with not knowing, my relationship with of-course-ness, my relationship with power. And can I just explore whatever's coming up for me right now as I think about all 4 of these relationships?